Good afternoon, this is Alan Ayers, just checking in from the Las Vegas Strip, standing in front of Caesar's Palace, which is currently hosting the 2016 Emergency Medicine Practice Management Convention. The topic I'm going to be talking to you about today are the retail health clinics, specifically those located in Walgreens and CVS stores. CVS has about 1,000 locations. CVS was early to the game. CVS really kind of chose a hospital affiliation model early on. Around the country, 28 hospital systems have partnered with CVS, including some platinum names like the Cleveland Clinic, Ohio Health, and primarily to provide supervision for nurse practitioners working in the CVS stores. But from the hospital's perspective, it also expands the hospital's brand catchment. It provides a point of access in the community, and from CVS perspective, it provides co-branding, which lends the hospital's brand halo to the clinical operation there in the drugstore. Walgreens has been a little less aggressive, was a little later to the game, has about 400 clinic locations, primarily going on their own, although recently it was announced that Walgreens was selling its 56 retail clinics in the Chicago area to Advocate, which is a Catholic health system, as well as selling about 25 locations in Seattle to Providence, which is another Catholic health system. Recent news reports regarding the Walgreens and Advocate deal really indicated that this is more of a land grab by a hospital system in a highly competitive market. In other words, a way for Advocate to expand their footprint in the community by partnering with a recognized name like Walgreens that has fairly high foot traffic through their stores. Now, the genesis of these retail health clinics, many believe, was to push prescription drugs. The idea was that patients would come in the center, see the nurse practitioner who would write a script, and then the drugstore would make money off selling the script. In actuality, the business case really has little to do with the pharmacy. It actually is driven more by over-the-counter. So if you think about it, a patient has sinusitis, they may need an antibiotic. However, they're going to pay for that antibiotic with their insurance, which is going to be a minimal copay, and odds are the antibiotic is going to be a generic. Some major retail chains give away generics for free. Some have 30-day supplies for $10. Others have generic for $4. So the generic prescription drugs isn't how the drugstore makes its money. Really, the drugstore makes its money on over-the-counter. So comparing the generic, which may be a $10 copay on a prescription plan, to say a $20 bottle of Robitussin, the drugstore is making far more margin on the over-the-counter. So if you look at who has sponsored the convenient care industry and who has really been a major proponent of these clinics, it has been the over-the-counter industry. Companies like Robitussin, Tylenol, promoting their products to the nurse practitioners. So in addition to writing a script, the nurse practitioner will recommend certain OTC products that are in the drugstore. More importantly, if you look at these drugstores in the United States, drugstores are essentially convenience stores. A probably bigger business case for retail clinics is that they drive foot traffic into the store. So a patient comes in with their sinusitis while they're waiting, they buy pantyhose, they buy candy, they buy beer, they buy cigarettes, they buy a newspaper. That's really how the drugstore makes money, and much of the business case is just driving traffic through the store. The more people you get into a Walgreens or a CVS store on a day-to-day basis, and the longer that those customers stay in the store, the more, quote, front of house type items that they're likely to purchase. Now, consumer behavior using these clinics, adoption has been relatively slow, although CVS now claims to be treating 18 to 20 million patients a year in its 1,000 retail clinics. So we are seeing an uptick in consumer adoption. I know that there was concern when these clinics launched that they would be competitive to urgent care, and to the extent that they are very, they treat a lot of the low acuity upper respiratory infections, otitis media, allergic rhinitis, low touch conditions that are commonly seen in urgent care centers. They can certainly be a competitive threat. And if you look at it from a consumer perspective, let's say you have an upper respiratory infection or sinusitis, having the option of paying $150 if you're on a high deductible plan to go to urgent care to see a PA, or to pay $75 to see a nurse practitioner in Walgreens, there seems to be a stronger business case in some instances to actually use the NP or PA in the retail clinic. However, we have not really seen that retail clinics have made a significant dent in the urgent care business. And if anything, rather than viewing retail clinics as competitors, I would really view them as a source of referrals. So if you think about a retail clinic, they're very limited in what they can do. First off, they're limited by the scope of the nurse practitioner or physician assistant's scope of practice. Second, they're very protocol driven, so only minor conditions that they list on a menu board are things that they can treat, and it's highly process driven how the nurse practitioners go about diagnosing and treating those conditions. And then they're also limited by space and equipment. Minute clinics and CVS are typically a 10 by 10 room. They don't have an exam table, it's just a chair. They do have a refrigerator for minor vaccinations. They don't have a restroom for any kind of drug testing. They don't have a lab. Walgreens clinics are a little bit larger, but still very limited in the scope, not only the scope of the practitioner, but the constraints of the physical facility and the supplies that they have on board. So that means every day there are thousands of patients showing up at retail clinics who cannot be treated, who must be referred elsewhere. The American Academy of Family Practice requires that retail clinics have a referral source, that they have relationships to refer patients to healthcare resources in the community. Now, if you were to talk to CVS, they would say that's the role of their 28 hospital partners. I do know of urgent care centers who get 8 to 10 retail clinic referrals a week, but how they do it is this. It actually goes to creating a relationship with the nurse practitioner working in the retail clinic. So if you were to call CVS Corporate and say, I have an urgent care center down the street from your Minute Clinic, and I would like to take referrals, patients that need a procedure, patients that maybe need lab work, patients that need an x-ray, things that clearly cannot be treated in the retail environment, the response you would get from the CVS bureaucracy would be, well, that's the role of our 28 hospital partners. We have that taken care of through the hospital partnerships that we form. But my experience is the nurse practitioners who work in these retail clinics take a lot of personal pride in the service and care that they offer their patients, and they want to do the best thing for those patients. So where I've seen referral relationships be successfully created is where the urgent care practitioner actually goes to the clinic, meets the nurse practitioner, personally introduces the services of the clinic, and so when a patient comes in to Walgreens or CVS can't be treated, that nurse practitioner on his or her own will say, well, we really can't treat you for that here, but there's an urgent care center around the corner, there's an urgent care center at such and such intersection who can care for your needs. Key is developing that one-on-one relationship and maintaining it over time. So, like any relationship, it must be cultivated in order to grow and prosper. And so I have seen instances where an urgent care will reach out to a retail clinic, turn the spigot on, the nurse practitioner is sending 8 to 10 patients a week. Well, over time, that volume kind of falls off because the urgent care did nothing to cultivate the relationship. If you can develop a relationship with an NP or PA working in a retail clinic, that's something that over time you want to follow up, you want to maintain, so that the NP or PA has assurance that the patients that they're referring to your urgent care center are having a good experience. So that's it for today. Again, this is Alan Ayers. I'm just checking in here at the Las Vegas Strip, talking to you about retail clinics. In these episodes, we would like to discuss whatever is important to you. If you have questions or comments, please contact us here at Practice Velocity at the address that you see on the screen. Thanks again, and look forward to checking in again on the next episode.